Hi, it's Dr. Russ. In a previous video, we did a lot of work on opening up the back of the hip, the gluteal muscles, the piriformis, and in another video way back, we did the back line of the leg, and we'll link to those two videos in the description here. Today, we're going to look at opening the front of the hip, particularly the psoas, the rectus femoris, which is the part of the quadriceps that crosses the hip, and the TFL, which stands for tensor fascia lata, which is a small, pretty weak hip flexor, but super important because it attaches to the IT band. As always, I want you to know this is safe if you have a recent injury, as long as you don't push through pain. And what you need to do this is a towel or some kind of cushion for your knee on the floor, and just something to balance on. I'm going to use my Pilates reformer. You can use a chair, a coffee table, a bed, a couch, whatever works for you. Let's talk about that psoas muscle first. It attaches from the front of the hip right here and runs deep all the way in the front of the spine. It attaches to the front of the spine all the way up to the top of the lumbar spine and actually hooks into the diaphragm. So it influences your breathing. It influences the entire upper body posture. It influences all of the lumbar vertebrae. It influences the sacroiliac joint, and it influences the hip. It's especially important in disc cases because that psoas muscle inserts directly onto the disc fibers. And when that muscle is tight and short, it will pull on, compress, and irritate an already swollen and irritated disc. That rectus femoris muscle attaches from the front of the pelvis and comes all the way down to the knee, actually crosses the knee and attaches to the big bump on the front of the tibia called the tibial tuberosity. It's part of the patellar tendon. The tensor fascia lata runs kind of where your front pocket is. If you laid your hand on your front pocket, that would be your TFL muscle, and it's pretty short. It's only going to run about here, but it attaches right onto your IT band, which of course comes down, crosses the knee, and is so important for athletes and runners, and really anybody who uses their lower body a lot is going to have an IT band problem at some point or another. So if you feel like low back pain, hip pain, and especially a lot of folks just feel like there's a lot of tension or pain in the front of the hip, this particular series of movements is for you. It's going to take you about 5 or 10 minutes to do both sides every day or every other day. So let's get into it. I've got a towel down on the floor, and I've got my knee on the towel as a little bit of a cushion. You can see that my toes are not under, but the top of my foot is flat on the floor. I'm going to balance myself on my reformer, and with the leg that's bent and the foot that's on the floor, we want that heel a little bit in front of the knee because we're going to be lunging into that, and we don't want to hyperflex or endanger our knee in that way. So here we are. It's also important that the foot is pretty much right behind the hip, not in and not out, pretty much right behind the hip. So if you're familiar with our imprint or our posterior pelvic tilt, that's a really important part of this movement. If not, go watch that video, because what we're going to do is a very gentle imprint, posterior pelvic tilt, as if we're imprinting on the wall behind us. So it's not a slump, it's not a curl, but it's definitely not an arch. At no point during this exercise do we want to extend our lumbar spine or arch our back. We want to be in a very slight imprint, the pelvis tucked, the sacrum slightly tucked, and what we're going to do is we're going to take this whole unit, my shoulders right above my hips, my pelvis a little bit tilted, I got a little bit of an imprint, and I'm going to just slide this forward, and I just need to go a couple of inches, and I start to feel the opening and the stretching and the elongation of my rectus femoris here, right here. And we're just going to breathe into that. Your options are to hold, or if you wanted to do a little bit of rhythmic movement, to come out with the in-breath, and then sink into it a little more with that out-breath. My glutes quiet, my low back is quiet. There's really nothing for those muscles to be doing. Now I'm just going to let that take its time and open that muscle. You notice that I am not bowing out on this hip. This hip stays in line. Now once I've done that, I'm going to come out of it a little bit. I'm going to take my foot now and bring it away from my midline. So I've got some internal rotation of that hip. Commit to that imprint again and shift that whole thing forward just a couple inches again. And now I'm targeting more on the TFL, the tensor fascia lata. Same idea. Nice easy hold. Never push through pain on a stretch. And slowly that stretch increases. I'm going to come out of that now. Get my foot right back behind my knee again. I'm going to bring this foot a little farther forward because we're going to lunge a little more. This next part of the stretch is going to bring it up, much more into the psoas muscle, into the proximal hip flexors. And again, we do not want to arch our back. So what we want to do is that imprint, that pelvic tilt, sacral tuck. I'm going to shift forward like I did before, only now I'm going to lean forward, get my abdomen on the thigh, and I'm really going to kind of lunge into this front leg. Now this is not easy. You can hold on to two objects like you have see me holding on to the floor. So I'm fully flexed in my left hip. I'm fully extended in my right hip, but my spine, as far as the relationship of the spine to my pelvis, is still neutral. I'm not slouched and I'm definitely not arched. You can get yourself into a more intense feeling of a stretch if you arch your back, but you're going to be compressing your lumbar spine unnecessarily. I've got a nice big stretch in the front of my hip here. It's coming all the way up to about the middle of my abdomen. And this is safe for my lower back. It's safe for my lumbar spine. It's not easy. It may take you a few tries to be able to get into that position, but it's worth it. Okay, same idea. The foot is behind the knee. My hip is not bowed out. It's nice and tucked in. Pelvic tilt, imprint on the wall behind me. Heel in front of the knee on the stance leg. I'm going to brace myself on my reformer, shift forward just a couple inches. That's all I need. As long as I maintain that pelvic tilt, I'm going to get a nice stretch on my rectus femoris on this side. Couple of breaths. I hope you're doing this with me. The glutes quiet, low back's quiet. It's a little bit of engagement of the lower abdominal core in order to maintain that pelvic tilt. Shoulders are quiet, neck's quiet. There's no need to hunch my shoulders or neck on this movement. I'm going to come out of it, bring my foot away from the midline so I internally rotate that hip, my left hip. Commit to that pelvic tilt and bring it forward. Now I feel a lot less tight on my left side in this muscle. I just use my right leg a lot more than my left. People do have a dominant leg in addition to a dominant hand. The dominant leg and the dominant hand are usually on the same side, as is the dominant eye. Let's come out of that gently. Feel free to take as long as you want. Pause the video. Take as much time as you want in each of these stretches. We're going to bring that front heel forward a little bit more. We're going to commit to that pelvic tilt. I'm going to rock forward, really lunge, and now I'm going to bring my abdomen toward this top thigh. So I'm getting a full flexion of my right hip. I'm getting a full extension of my left hip, a deep stretch of my psoas all the way up into my lower abdomen, and no compression in my lower back. My glutes are quiet. My lumbar spine is quiet. I'm using my arms to support myself on my knee this time. My lower abdominals are slightly engaged to keep that pelvic tilt or imprint. And it's a big opening of the psoas on my left side. And a nice little opening of the glute on the right side as well. But that's incidental. We're going to come out of it. That's how I like to stretch the psoas. I recommend you try it. Wonderful for low back problems, hip problems, knee problems, sacroiliac problems. I hope you try it. I hope it helps you. Thanks for watching.